So put that glove on. Say a little prayer. If you're of that persuasion. Okay, this I can get rid of. Okay, now I'm ready to clean. No, I've cleaned already. I changed the procedure just to confuse us all. The thing I'm going to pack with, I'm going to unfold. I'm unfolding it. And I'm scrunching it up a little, and I'm putting it in my saline. Okay. And then I'm going to have a couple dressings to put over the top.
Now you can't touch the sides of that little container, right? Because
I can't touch the outside. I can touch the inside's all sterile. I can't touch the outside because
I'm. Lip of it right there. If you touched it, you'd be.
Then you'd be contaminated. Yeah. So I've got 2 gauze to put over the top, and I've got an ABD to put over the top. So I've got more dress. This was a better kit. Okay. Okay. So this is all clean and ready to go. So I'm going to pack it. And to pack it, I'm going to pick up my Q-tip. I'm going to transfer it into my other hand. I'm going to pick up my gauze, wring it out, and I'm going to start at one end. I'm going to have it crunched up in my hand. While I'm packing, I don't want this touching the outside of the wound, do I? I want it just to be inside of the wound. What am I trying to do with this packing? I'm trying to keep the wound surface moist, right? But I want to pack it loosely, or it can cause tissue ischemia. Your wound's going to end up bigger. So tuck it in with your Q-tip. When it's wet, it's much easier to pack.
How much do you want to squeeze it out?
You want to squeeze it. You want it to be moist but not dripping. And when it's wet, it would pack in better. Okay. Then over the top of that, when I pick up my dressings, I'm just going to touch the back. Because then I could be clean or sterile, couldn't I? I can also do this with, sometimes they'll do it just with clean gloves on. It's a clean procedure at our facilities, but they'll use a forceps and a Q-tip to pack it in so that they don't have to have sterile gloves on. If I'm putting something inside of the wound, I like that to be sterile. There's different schools of thought of that, but if you have a new surgical wound that's nice and clean, I think you should be sterile with the packing. So this, I'm going to put a couple of gauze over the top. I'm touching the back of the dressing. And then I'm going to put an ABD. I can touch that with both hands. I'm going to put an ABD or Surgipad over the top. I'm going to tape it like a window box, except we don't put tape on these things. I'm going to label it. What am I going to put on my label? Date, time, initials, maybe even what dressings you used underneath. And then we're going to document. Of course, I'm going to take off my gloves, wash my hands, clean up my mess, and then go document. And for your checkoff, we want you to actually do a DAR note and turn it into us, okay? Okay? Any questions? We're going to come around now and help you and watch you practice. Did some of you do it along with me? Okay, we're going to come watch you practice.